Good afternoon. This meeting of the Board of Health will come to order on Friday, August 11th at 12 p.m. And we will start with roll call.
Dr. Jamie Steig, Avish Nagpal, Arlette Preston,
Here.
Lynn Telford,
Here.
Kayla Nelson, Nimal Dai,
Hey, I'm here.
Tony Grimberg, Grant Severson.
Here.
Roll call is completed.
Thank you. We do have a small group today, so we don't have quorum. We won't do any voting today, and we will hold our minutes approval from our previous meeting to our next meeting. That will take us into our first up, right, is our walkability and neighborhood design presentation.
Thanks, Justin. I came down here so I could more easily do the slides. So you may not know this, but in my portfolio as city commissioner, I have both the planning department and the health department. And with my community health background, I have always seen a real strong correlation between the two. And one of the areas that I'm bringing to this board, because I'm trying to raise awareness outside of just the planning process about the importance of neighborhood design. And there's definitely a correlation between health status and walkability. So that is the content of what I'm going to present today. So first of all, what is walkability? It's also referred to as active transportation, meaning using your own legs and arms to get where you need to go. Short trips, meaning a neighborhood that is designed to encourage people to walk or bike to wherever they're going instead of jumping in their car. And then complete streets design is also certainly related to this whole issue of walkability, meaning streets are designed to accommodate not only cars, but also bikes and pedestrians. And then, basically the definition is the ability to meet daily needs and access amenities by walking, biking, skating, anything again that's considered active transportation. So that means your ability to walk to work or bike to work, your ability to walk to a neighborhood restaurant, do some shopping perhaps within walkable space, and even some entertainment venues. It truly is an attempt to try to move away from car dependency, and there's some benefits that I'll cover in that regard. Now, I have to say, this is not going to be necessarily a neighborhood design that everybody wants or probably will look for. But what I think hopefully as we move into the next phase of development, more of these kinds of neighborhoods will be available to people that truly want that. So just a real quick review on some of the local plans which talk about walkability. The Fargo Comprehensive Plan, which was put together back, it's about 12 or 13 years ago now, Go 2030, talks about creating fine-grained blocks that ensure trips are as short as possible for pedestrians and bicyclists. Also talks a lot about walkable mixed-use centers, which there certainly has been, I think, a trend in the development in Fargo especially, and certainly in West Fargo as well, and Moorhead as well, is having those mixed-use centers where there's commercial as well as residential mixed in, so that that whole concept of walkability is enhanced. The Moorhead Comprehensive Plan, even though they're not part of our board here, but looking at the entire community, Onward Moorhead does talk about incorporating a complete streets design. And then finally, West Fargo Comprehensive Plan has actually got some pretty innovative stuff in it. There's a section that talks about safe, efficient, and reliable transportation system that encourages active transportation while balancing all modes of transportation during all seasons, offering strong linkage between neighborhoods and incorporating a network of complete and walkable streets. So just a little bit about current design, and as I've mentioned, we've started to probably move away from it a little bit, but it still really is car-centered, and we were just having a conversation earlier about the streets around schools and how difficult it is to sometimes make sure that children are safe when they're going to school. So it's still really pretty heavily car-centered, mostly not friendly, and I'm talking about the newer developments. Now, when you go into the core neighborhoods, it's a little bit different, but in the newer neighborhoods, not real friendly to pedestrians and cyclists, can actually be life-threatening. And I always use this personal experience. I don't know if you all know it, but I live downtown, and before Main Avenue was redesigned into what it is now, literally, I had 4 incidents within 6 months where it was a near miss, and that is completely scary. So that sense of insecurity with wider streets, fast traffic, people turning left and right and not looking necessarily for pedestrians, it becomes dangerous. So why are we talking about this at the Board of Health? It truly is important to the public health status. There's a walkable neighborhood provides for a greater sense of community with increased social interaction, a lot more opportunities to mingle. And I've lived in 3 different neighborhoods in Fargo. One of them was certainly a little bit more neighborhood friendly. The second one was not, and that one was further south. The third one is downtown, and it is such a huge difference. You get to know your neighbors because they're out on the sidewalk, and you get to talk to them, and you get to see them almost daily. So that greater sense of community is related to that interaction that happens on the sidewalk. Higher walkability in neighborhoods is associated with decreased rates of obesity and diabetes. And then finally, walkable communities provide the opportunity to incorporate more activity into everyday life by walking to and from work, taking a stroll to a local restaurant, or running errands. So there's actually, when you Google this topic, you get a long list of research that's been done to show the correlation. Certainly it's not causation, but certainly correlation, strong correlation between walkability and health status. Journal of American Heart Association, 2019, adults living in a less walkable neighborhood had a higher predicted 10-year cardiovascular disease risk than those living in highly walkable areas. Walking as a low-intensity physical activity is associated with healthier populations since it contributes to lower rates of obesity, diabetes, and cardiovascular diseases. And then walking as a physical activity is associated with lower body mass index, controlled blood pressure, and lower rate of diabetes again. Neighborhood walkability is associated with lower respiratory disease rates, such as asthma in children. And finally, the last research that I've listed here was more related to a rural kind of environment where it's very car dependent to an urban development kind of environment. And that one showed that neighborhood walkability and urban development are connected with lower chronic disease, better mental health, and reduced smoking. So, in addition to that, there are other benefits. Big one being economic. And there's been some concept that at least I've brought up in many different venues is the ability to build residential around employment centers. It allows for an individual to actually exist and live and work without a car. And the average cost of owning a car, and this came again off Google, is around $11,000. But that was before gas prices went up and interest rates went up. So I'm assuming now that average cost has gone up beyond the $11,000. So when you're talking, and we just finished a housing study that showed 96% of the individuals that have an income of $35,000 and under, and it doesn't include the heavily subsidized lower income, but those that are working with an income of $35,000 and less are 96% of them are cost burdened with housing. So you lop off in another 11,000, although there's still going to be some transportation costs there, but you lop off that 11,000 from a $35,000 income, it makes a huge difference. Environmentally, certainly it reduces automobile-based transportation and thus carbon emissions. So there's lots of benefits that way in the environment. It also probably, ideally in the long run, may very well decrease the need for bigger and wider and more streets. So on that side of the cost issue. And then finally, there's a study from 2003. It comes from a California-based think tank that a walkable community actually attracts new economy workers. And we're seeing that with the younger generation. They look for environments in which they can get out and meet their neighbors. So just a little brief explanation of what's going on in Fargo. And I know, again, West Fargo is actively engaged in this too. Incorporate walkability into our future plans. And we are currently undergoing an update to the growth plan, which the growth plan is really a plan to establish approach and concepts to be incorporated into new neighborhoods as well as infill development. But the focus is really strongly on new neighborhoods. So trying to incorporate that into the new growth plan. And then, so there is a local group. It's called Strong Towns Fargo. I don't know if you all are familiar with Strong Towns, but Strong Towns is a nonprofit based out of Brainerd, Minnesota that has been working for a long time in trying to address how streets interact with neighborhoods and with the land use around them. So a local group is working to bring a walkability expert into town. And the intent with that would be to help create a common understanding of what walkability is, because you use that word and people have different understandings of what that is. So to increase the awareness level, a common understanding, and actually this person hopefully could do an audit of a couple of neighborhoods and say, oh, this is good, this isn't so good, that kind of thing. So hopefully that will still happen. Maybe this fall yet, if not, next spring. So that's it. Just interested in questions or comments?
I had a question. Communities that I've lived in that had pretty good walkability, one thing that was a persistent presence was a really robust mass transit system.
Yes.
And so certainly I don't necessarily feel like Fargo has as robust. And so certainly if you want to reduce the amount of cars and things like that, that would be helpful.
Yep. Right alongside this issue is transit-oriented development, which it's, we've struggled in Fargo here to have a transit system that is real robust. I was just talking to somebody the other day who one of his employees actually tested the system just to see how well it worked. And she tried to get from South Fargo up to the industrial park. It took her an hour and a half and not the most user-friendly system. So alongside of this, because most people won't be able to probably be within walking distance of their employment, yeah, we need to work on the transit system. One of the other things, and maybe I can just bring in our earlier conversation, we have a study that was done with recommendations not too long ago, I don't know, maybe 10 years ago, on safe routes to schools. And there is a study going on right now on University and 10th Street, and there's, I don't know, at least three schools along University, and yeah, I can't think of anything right now that's on 10th, but those arterials being close to or immediately and adjacent to a school requires even more detailed and thoughtful planning. And incorporating the recommendations from Safe Routes to Schools, I think, would be terrifically important, another whole piece of that growth plan and how we improve things as we move forward.
Yeah, I think walkability includes health status, but also safety. So as we were talking earlier, my neighborhood is flanked by 45th Street and 42nd Street. So I'm very close to Osgood Hornbachers. I don't like to walk there because I don't love crossing 45th Street on foot. Sandy's Donuts is there. My kids love to go there, and we rarely walk because I'm just really nervous. Cars don't pay attention, to pedestrians when they're trying to turn and stuff. And then you have Kennedy, which is built right on 42nd Street. So from a safe routes to school perspective, it's pretty concerning. So I think the applicability of this presentation for this group is that we can be advocates in our different positions for the increased walkability in our community, both from a health and a safety aspect. I was curious for public health if environmental design as it relates to public health is ever considered as part of strategic planning, or if you guys are ever included in conversations with engineering.
We actually are part of their growth plan just recently. Dr. Newman is actually on their executive committee for the growth plan. And so that's probably been within the last month or 2 months that we've been involved with those conversations. Prior to that, we've done walkability with our health promotion division, just from Streets Alive and those different outdoor activities, but never really involved in that neighborhood planning portion.
So sounds like maybe a start then.
Yes,
Yeah.
that's partially what I'm advocating for, is bringing that health perspective into that planning process. That includes from the community as well. So advocacy from you all as individuals and as a board would be important. Yeah.
I just want to say thank you for the presentation. It's really well put together. From the standpoint of where I live, I do walk a lot because I'm like inside the 28th Street and going to 40th. So then you can go across it on the 40th. There's usually like a light there that will like stop the vehicle from moving so the kids can cross and then go into the Centennials. And then also too, there is a pass there for Alzheimer's Association where I get to do my exercise. So it's a bit different. I think every neighborhood is a bit different in design and the way that it is done. But I think mostly what I worry about was the speeding of the cars, and them not paying attention to the kids when they are walking or when they're biking, or just individual that is just running, because I've seen it a lot of time, and that's where is worrisome come in for me, because sometimes there's almost a hit and run for one of the child, just because they're not paying attention of where they're going.
Yeah.
And but overall, I think that just from a public health perspective, or just me as a public health person, I think this is very great layout. It's very understandable. It's very readable. You present everything that you said as a community health person to make sure that our community is healthy and just to celebrate it overall. So thank you.
The other thing that's happening, again, I'm speaking from the perspective of Fargo here, is a new transportation plan. And, you know, the whole finding the balance between moving traffic and slowing traffic down, which a lot of this is related to, you know, if you're walking on a sidewalk, especially if the sidewalk doesn't have, you know, a barrier of some sorts, grass or trees or something between the sidewalk and the street, and the cars are going by at 40 miles an hour, it's really intimidating. So, you know, a lot of the argument that I hear is, well, nobody walks there anyway. Well, part of the reason they're not walking there is because they don't feel safe there. So, which is the chicken, which is the egg? I would say the design is a large part of the issue there. So, trying to address this early on in the process, you know, it takes kind of a mindset change. Yeah, for sure. All right.
Any other questions? Okay,
Any
thank you
other-
very much.
Okay, thank you.
Okay. Okay, thanks again, Arlette, for that. Next up on our agenda is the nursing program updates, Fit and Strong, and the gun storage education.
Okay, I'll just give you a quick update. First, Suzanne couldn't be here today. She's off. Just wanted to circle back on the gun storage safety that we had talked about at one of our prior meetings. So Suzanne has been working with Sarah Kemp Tabbitt from the VA. They have a program on suicide within the veteran population, and they have been willing to partner with us to provide the cable gun locks for some of our programming at Fargo Cass, which is really exciting. So we don't have all the details worked out, but we do have that partnership plan to go forward. We're still kind of looking at the various platforms that are out there, whether we're going to go with, you know, the Be Smart education or the AAP education. So that's still kind of in the works. Suzanne is working with Holly from our comms team to try to work out some of the resources and what we can use for resources. So the plan right now is to start hopefully by the fall with our home visiting clients. So those would be mostly, there would be adult health, but mostly some of the maternal child health population that we deal with. And then the hope would be to kind of put that into our clinic services as well and have an offering going forward. So just wanted to give you an update that we are making some progress with that, but we're still working out some details. And then I will turn it over to Rachel, who will talk about our new Fit and Strong program, which obviously goes well with our walkability conversation, as this is a program too that will work to combat some of the chronic disease that is in our over 60 population.
Perfect. Thank you, Desi. So this is not something that I created. I asked, we have 2 RN nurses who went to the training, and I asked them to provide me with some of the details of the class. So Fit and Strong is an evidence-based physical activity and behavior change program model brought to us by NDSU Extension. It was created at the University of Chicago, and it's approved and recognized by the CDC and the Administration of Aging and many others. I can give just a brief background here. They did do a large trial of approximately 500 participants, and skipping over a bunch of the numbers, what they found was significant improvement in lower extremity joint stiffness, pain and function, lower extremity strength, mobility, and anxiety and depression improved. And these results are important because the lower extremity strength and mobility are both risk factors for falls, and of course mobility is an independent risk factor for mortality. So like I said, we have 2 RN instructors. They did participate in a 2-day training in Bismarck. We held our first Fit and Strong class in spring of 2023. We had 11 participants. We're currently leading 2 Fit and Strong classes. One has 14 participants and one has 11. And we're also currently enrolling for our upcoming fall class starting in September. I also have some testimonials from some of the participants. One said, "I look forward to coming to class. A great class, lots of fun, helpful information, cheerful and fun instructors." And then a couple of stories, abridged versions here. So one participant had fallen, and she attributed her ability to get off the ice to her strength training at Fit and Strong. We had a second participant that had noted she had previously been taking large doses of Tylenol regularly to manage her joint pain, and she stated that she had decreased her need for Tylenol substantially and only needed one Tylenol during her 12-week Fit and Strong class. And finally, the participants have all shared that the social component of the class has been great for them. They look forward to coming to class, not only to get the physical activity, but truly appreciate the social setting with other community members and have made friendships. So that's all I have.
I was just going to add in some of the, so this is a free
Yes.
resource for people in the community. It's for those over 60. And so really, again, it's bone strength and all those things that we want to work on with the older adults. It is a twice-a-week class for
It's 12 weeks.
12 weeks. So they, like I said, they'll either come to our building, or I think we're hosting the second one at a church location. And so it's been really well received, and it just teaches them kind of those life skills that they can continue at home with, you know, weight training and things like that that are really important as we age.
During the actual class, it's an hour and a half, so they have 60 minutes of physical activity, and then they actually take a 30-minute opportunity to do discussion, and they have a curriculum. They each have a book that they read out of and share their personal experiences with.
Thank you for that information. Does anyone have questions or comments?
She answered most of my question. I was going to ask her where are these fitness classes being held. It sounded like she said at church, and it is twice a week for 12 weeks, right? Yeah. So, and it's free too. So I was going to ask how much is a cost. So, but it sounds like it's free for the community. So.
And is the goal for more expansion of these programs? And then how are they being advertised so you're getting enrollments?
So right now, initially, our very first class, we weren't sure how big this was going to get. So we did reach out to our current public health retirees, if you will, and 11 participants. All 11 of them have reached out and asked if they could re-enroll to the next class. So without filling up the class to, you know, without offering it to the community. So we're doing media releases prior to each class for advertisement. And word of mouth. Seems like, you know, the neighbor says, "I've really enjoyed my exercise class, you should join me with the next one." So word of mouth has gotten.
And Dr. Severson took my questions, so did you have any? Okay. Sounds like a great program, and I anticipate that it will grow, so we'll be interested to see how we match the need as it comes. Okay, next item is the nursing program updates.
Actually, I went first, so that was just the gun
gotcha.
storage safety, and then this obviously is our newest nursing program. So we are done with that one.
Okay, sounds good. Next item is environmental health update.
Good afternoon. For those of you who haven't had the pleasure to meet, my name is Grant Larson. I'm the Director of Environmental Health at Firecast Public Health, and I appreciate the opportunity to give you an update on our division. That being said, environmental health division is made up of the director. We have 7 environmental health practitioners, 1 environmental health associate. You can see office associate, and then 1 or 2 seasonal employees, and then an internal half-time environmental health practitioner who's also emergency preparedness individual that assists our division. The areas we cover, of course, are Fargo, West Fargo, and then the 6 southeast counties in North Dakota. And what I'm going to do next is explain the services that we have in each one of those areas. So in Fargo, that's our most robust area. We have all of our programs in Fargo, in the city of Fargo. And I won't read all of them. I will highlight some of them at the end. But for that amount of staff, we have to know a lot about a lot of different programs. And so we have certain inspectors that are assigned to different areas, and everybody does food because that is the biggest area. As you know, we have a lot of restaurants in Fargo and West Fargo. In West Fargo, we have less programs, but since the restaurants have same ownership, whether it's one ownership in Fargo and West Fargo, and they have adopted our food code along with these other programs that we do license and regulate in West Fargo. Please let me know if you have any questions anytime. I forgot to mention that. And then the southeast counties, some of them have adopted, so the on-site sewage treatment system program, some of them have adopted them through their county commissions or Board of Health, so that'd be in Cass, Richland, and Trail, are required. So those counties we are in the most, but we also make it available, and we do work with Ransom, Sargent, and Steele if they request their services for that program. As far as aquatic facility or pools, same thing. We have 3 counties that are required. They adopt their services, and then the other ones were available for consultation or help. And the nuisance complaint program, it's available to all of them, and we work in conjunction with the state, or if there's a local town or city that might have their own ordinances, that we can help them to abate a nuisance if that's at our discretion.
So Grant, can I
Sure.
ask a question there?
Yep.
Go back to that other. So the fact that you're providing a lot of services to various different counties, are there like state regions or something that has split up the state into regions for your programs? Or-
Correct. So and there's environmental health and there's financial support for the different regions. And I can't delineate all the other ones throughout the state, but since obviously we're close to the southeast, that's the ones that we cover.
And does the state provide the funding for it? Or?
Correct.
Okay.
They supplement funding. We do get some fees that in turn it's a financial thing, but we give back to them, but then they have their credit for the funding that they have from the state. We work that out, but the state, to answer your question, does provide funding for some of their services.
So I'll just add on that as well. So the state, recognizes that there's larger health departments that have more resources, and then there's smaller ones that don't. So they kind of made these regional areas so that we could essentially share resources and help those that don't. It doesn't make sense to have, they can't support an environmental health division in these smaller counties, and so then they just rely on the larger health departments to help with that.
Thanks, Dizzy. Any other questions? That's good. Okay. So now I'll take some time just to highlight some programs, a couple of our programs. The one animal boarding program. The history on that is this was implemented in 2020. And we saw a need for this because before this program, basically it was the Fargo PD and their animal control officer. If they got a complaint in one of our boarding facilities, whether it was kennel cough or dogs fighting or any odor or any kind of environmental any kind of different situations, they were kind of more reactive than proactive. So we work with the Fargo PD closely and several different programs. So we said, we could lean forward here and implement this program, because we also have a pet store program, and basically it's looking out for the welfare of the pets because they're part of our community and part of our homes. And so what we did was we modified the pet ordinance, and then we put this program together. It was passed by the commission in 2020 So once a year, we go in there and then we would inspect these facilities and make sure they meet our standards and, answer any questions. And if there's any complaints, then we'd follow up on that. Currently, this program's only in Fargo, not any other jurisdiction. And we have 12 facilities that are licensed in Fargo.
So that means that those boarding facilities have been licensed by the city and provide a certain level of standard of care for the animals.
Correct. Yep. These are the commercial ones. We don't go in-home, no residential. Yeah, the ones that are commercial that you could go to bring your pets to, that's the ones that we license, correct? Yep.
Grant, one more question there. So it's a requirement, so the 12 facilities, that's as many as we have in town?
Yes, it is a requirement. Like I said, not residential, but if they're brick and mortar, it is required. And so, when you implement any program, and I'll talk about another program, when you implement one, it's always hard because, you think about how do you reach these? You go through you Google it or the Yellow Page or whatever, So we try to get out, but, that population in that industry, is really forthcoming and said, oh yeah, we refer our animals over to that one. And so I think we got a good grasp, but the 12 are the firm ones that are in Fargo right now. Any other questions? Okay, moving on to the food program. Like I said, that's the big one, Food and Drug Administration. We're currently enforcing the 2013 FDA Food Code. We enforce the one that's adopted by the state, and then it comes to Fargo through resolution. So it's kind of an automatic thing when they do updates. And there is one now coming, and they update every 4 years. So if we move to the 2017 Food Code, that's what the state's looking to adopt now. And that vetted process through the FDA. If they're going to make changes, then it would come down to us, and then we'd implement those at a local level. It's kind of split there, but I think it says 1,407, I believe is what it is. Food-related licenses, that's for 2023. 75 mobile food vendors and 29 temporary events. Obviously, the temporary events, since I've been here over my tenure, have increased dramatically. And there's a different fest every weekend. Blues Fest, Rib Fest. This week I'm going to help out with the Renaissance, right? It's up at the horse park. So a lot of different temporary events and food vendors that we have to regulate through the summer, as well as all those brick and mortars that continue operating annually. And to break it down a little bit more, so the ones how we license them, I just thought I'd bring it to your attention. We license them on risk. And this is what the state does in the FDA Food Code, which makes sense. In the past, we've done it by square foot of the building, how many seats they have. Well, that doesn't really reflect the risk that they're going to operate. Like a tier 1, that would be like your gas station, right? You got a hot dog, some nachos or whatever. It's a little risk to prepare that. Tier 2 would be your fast food. Pretty much, a heat and serve or just make and serve. And then your tier 3 is a lot more risk. That's your heat and serve. It goes through different processes. You have leftovers, sushi, all those different processes that are higher risk to our consumers that we want to make sure that we get in there and license them accordingly. What we do is at a minimum, if you're a tier 1 license, we get into your facility once a year, tier 2 twice, and tier 3 3 times. Now we will go in more if we have to follow up visits or inspections based on how they perform and any other complaints that we might receive from the public. We will go back into there. But at a minimum, there's 1, 2, or 3 inspections. Any questions on that? Okay, I'll move on. The massage therapy program. So this is only in the city of Fargo. It was implemented in 2021. We currently have 99 licensed establishments. Just going to highlight the history of this program is the State Board of Massage Therapy licensed individuals therapists. But if you look on the website, it says if you're going to open your own massage establishment business, to contact local jurisdiction. So once again, we found a void there that we filled to license the establishments, not the individual therapists. What we are finding out that a lot of them are individual owners. They're sole proprietors. So we're gonna look at revising some of these possible ordinances and the fee schedule this year, and we take industry input on that. But there again, to reach out, we didn't know the different business models. It was really tough to try to capture all those. But we did work with the Board of Massage Therapy, and they provided to the current operators that are in Fargo, because that's where this ordinance is specific Fargo and not West Fargo at this time. Nuisance complaint program. What we do is just Fargo again. This primary type of nuisance that we enforce are tall grass and weeds. You drive up and down all the roads that you were talking about, if it gets over 8 inches in height, if we get a complaint, this program's complaint driven. You can drive around town, but to date, I think I'll bring up some numbers. We already have 700 or so, and last year we had 1,100. That's just complaints being called in. And the city, as we know, has gotten really big. So that's what our seasonal employees help with specifically, because we're running a lot of these complaints. We do have good collaboration with the city of Fargo as far as the building inspections, because there's other complaints out there when you talk about nuisances, garbage, junk, hoarding. So we work collectively, and building inspections really helps us out, as well as the PD if it's unlicensed vehicles or vehicles not parked in the right place. So we work collectively, and we have a code task committee that meets quarterly, and we make sure that we don't run parallel when we're addressing these different complaints or properties that might have multiple nuisances on one property. So just so you know, as far as the tall grass and weeds, run down how the process real quick works. If we got a call today and said, so-and-so lives on First Avenue and whatever address, and he hasn't mowed his yard, I think it's bad, we automatically just kick out a letter. And it says, dear so-and-so, as a property owner, you're required by ordinance to mow your property. If it's out of violation, it will be abated. So we give them the benefit of the doubt that they're mowing, but after 7 days passes, we give them a week, we still go by that property and go, oh, yeah, it's mowed, or it's not. And if it's out of compliance, we have a contract mower we do through a request for proposal process. They're in place for 2 years. So what we do is, it's out of compliance, then we send them an email and say, go ahead and please abate the nuisance by mowing it. We cannot make them spray for weeds or anything. A lot of people ask us for that. We can just mow. But it does take care of a lot of the, obviously, nuisances. And what we're trying to abate the grass. It's an aesthetic thing, obviously. It's the site on the property. But we're trying to eliminate harborage for mosquitoes, for rodents, for all that stuff. So it takes care of it when you cut the grass. So here's just, like I said, a roll-up of the last couple of years of how many complaints we've had. And I think I asked yesterday, and it's getting up there in the high 700s, because they roll in, especially when we hear the rain on the roof. It's going to make things grow, right?
Are the property owners then charged for the mowing?
Great question. They are. So what they do is, when we get a mowing bill, they'll send us back the receipt for their mowing services, which they again went through a process. So that's a fixed hour per hour, if they're mowing or the weed whacking or the drive time. And so they send us a bill for their services for that property. And then we tack on a $40 administrative fee, which is actually going to move up next year. The commission approved a new fee schedule. But yes, so we tack on that mowing and then the fee, and we send it to the property owner. And then if most, I guess I can't remember or guess the percentage, but I would say about 90% pay. They might not be happy with the bill because this is $75 an hour they charge. So your residential lot is, almost $200. So they're like, I could get somebody at $35 to mow that. And that's what we're saying is, we're not a mowing service. We want you to get somebody to mow it yourself, right? And then what happens is, if they don't pay, the other 10 or 20% that don't pay, we just had the city commission this past Monday. So after a year, then the city auditor's office assesses it to the property taxes. So in essence, it will get recovered either by the property owner paying or being assessed to the property taxes for their financial invoice. So I went through that fairly quickly in the essence of time for the other people that are going to present. But do you guys have any questions about any of our programs or how we roll or operate?
I'm not sure I realized all of the programs that fell under environmental health, so I do appreciate the presentation. Questions?
I don't have a question, but I think that it's a really great presentation, and our community get to see what the environment does and what program are there. So now if somebody is having like huge lawns, and I guess I didn't know you can call in until today.
You're going to see an increase in your complaints.
That's usually what happens. Yep. So, but yeah, we try to be as transparent as possible. There again, it's to better our community. Our services are out there to try to do that. So we want them to utilize that, but you can call in or go online too. There's a City of Fargo One app. So if you want to utilize that for a restaurant complaint, a grass complaint, or any of that, you can do that. That's the patrons that can utilize it.
Question though, how often do you get to the restaurant, check them?
You remember the tiers I talked about?
Yeah,
The 1, 2,
okay.
and 3. Yeah.
Got it.
So minimum 1, 2, or 3. Yep. So we
Gotcha.
get in there. Yep. So, and unless there's a complaint, or the other day, unfortunately, one of our places had a fire. So obviously work with the fire department. We get in there and, keep them closed until they restore back to a level where we can open back up through inspection. Good questions. Okay. Thank you for your time.
Thanks, Grant.
Yep.
Okay, our next agenda item is harm reduction update.
Yeah, I was just gonna let you know, in the initial agenda that we put out, we had harm reduction videos written. And so just for your awareness, Justin and Holly from our communications team have been working on some harm reduction videos just to highlight staff and the programs. And then City Comms has been providing some videography support to those videos. And then given the events that we've had within our city, we've obviously had some delays on their time. And so we will be putting out those videos at some point. So we will give you updates on that as we progress. But for today, Jan and I believe Chandler are just going to come and give us a harm reduction update and let us know what's going on in the community.
Hi, everyone. We want to provide a brief summary of some of the things that are going on in the community. I know the mayor's office and Desi and myself have all experienced an increase in calls and communication around questions and concerns people have of what they believe are increasing numbers of camps down along the river, an increase in people hanging out in public spaces and so on. Certainly, 2 weeks ago, we did a summer point in time count, and that's where we go out and we attempt to find as many people as possible in the community that are unsheltered. We generally have a pretty good idea of how many people are homeless in the community and accessing shelters because we have systems in place to count those numbers. But getting an idea of what's happening outside of shelters for folks that are unsheltered, either sleeping in places not meant for human habitation, sometimes couch hopping, sometimes sleeping in cars and so on. We have to really get out there. So we sent a number of teams out throughout the community and counted the best we can. In the downtown area alone, we found over 40 people that were unsheltered on that particular night. And I think that's representative of what we're seeing everywhere. The numbers we're seeing in our programs, the number of people we're serving daily and so on have jumped significantly. And I believe that some of these numbers are representative of a growing, they could be representative of a trend and trends that we're seeing in our community that aren't unlike those that we see nationally, which Chandler will talk about in a minute. Excuse me. So at the deck on August 4th, we experienced a record number of people walking through the doors. That was 145 people visited the engagement center that day. Additionally, we've seen over 300 nights of shelter provided at the Gladys Ray in the first 10 days of August, and over 1,000 interactions or encounters with people at the deck in those same 10 days. These are all much higher numbers than we've experienced in the past. Some of the questions that we have coming in, I get questions from people all over town. It might be South Fargo, it might be by Jefferson Park, certainly downtown, because again, when you have a walkable neighborhood, certainly more people are concentrated in that area, and then we see people experiencing homelessness also concentrated in those areas. The number of folks that we see setting up places to exist outside of the Civic Center, the library, all of that, while troubling, it's also, I think, a sign of things to come if we don't figure out some things as a community. A number of those folks are very young. A number of them are people we haven't known for very long. And, the common belief among folks who are experiencing homelessness is that it's okay for them to be on public property, which is why we're seeing a lot of folks at the Civic Center and at the library. And I do try to explain that to people, but it certainly doesn't take away from the fact that the community is very concerned right now about what's happening. And those concerns vary from garbage that's being left behind all the way to just the sheer number of people that people are seeing. The number of questions have come in about the deck specifically, or about the engagement center, what we call the deck specifically, and whether or not that's causing this increase in the number of people who are at least perceived as homeless in the downtown area. And while some of the folks may very well set up close to the deck because that's where they're getting services, again, the deck exists right where there are other public buildings and public spaces. So I believe that's why people are there. Yesterday, there was minimal activity around the Civic Center. Today, I drove up and it was raining, and there were a number of people underneath different overhangs and in doorways at the Civic Center because, of course, people want to be dry. I'll let Chandler take over and talk a little bit about national trends, and then we can answer questions and hopefully talk a little bit about what the solutions are for our community.
Thanks, Jan. So just to also kind of maybe do a little myth busting and talk about the engagement center, we are aware that the homeless population has been a part of our community for a long time. And so we exist where we are to meet people where they're at. And multiple things can be true at the same time. This population has been in our downtown neighborhood for a long time, and we are seeing an increase. Nationally, there's lots of interesting data that's come out. The National Alliance to End Homelessness recently released their 2023 State of Homelessness report. And what we know, and what we know about our community as well, is that the need for shelter far outweighs the availability of shelter. And on average, about 40% of people experiencing homelessness are unsheltered. That statistic actually jumps up to 62% when we focus specifically on the chronically homeless population. So people who have experienced persistent bouts of homelessness over many years. They tend to be the most visible people experiencing homelessness in our community. And so just wanted to highlight that our community is dealing with some of the same trends that we're seeing on a nationwide level. And we are also still not at the rate of some of the larger communities that we see in the news quite a bit. So we have an opportunity to act. We know that people that we see who are unsheltered need housing. They need a place to live. And so to just have that compassionate heart for the people in our community and recognize that this is a solvable issue, and there are things that we can do. There are policy changes we can implement to make housing easier for people to acquire. But again, that we are in alignment with some of those national trends, especially when it comes to unsheltered homelessness.
Questions or comments from the board? Yes, Arlette.
So, Jan, you mentioned with the last count, there was 40 unsheltered. And I'm a little confused in regards to when you're talking about an increase in the homeless, that count, if I remember correctly, is done on a limited basis. So when you're talking about an increase, are you talking about quarter to quarter, year to year?
Yes, good question. So we do the count every year. It's a mandate by HUD,
Right.
of course, but typically we do it in January when it's very difficult to find the people in our community that are unsheltered. In North Dakota and Minnesota, we've known that, we have to be able to demonstrate to HUD and other entities that we have many more people experiencing homelessness in our community than we're able to demonstrate in January. So we split into teams, and those teams go out throughout the entire community, and we've compared to other summertime counts that we've done and just what we've known to be true in the past few years, because we generally have our finger on kind of the pulse of how many people are out there just because of our work in shelter and drop-in center and all of that. But compared to other counts that we've done, we found far more people this year than we have found in previous years.
And that was in January, or?
We did one in January. We did a couple of summertime counts a few years back. I don't remember those exact numbers, and again, those were just local counts. They weren't, well, the one we just did 2 weeks ago was actually a statewide count, and I'm not sure yet. The report hasn't come out that's compiled all of the numbers. I don't know what other communities are experiencing, but I know what I see, and what I believe is that there are many more unsheltered folks in our community today than there has been historically.
One more thing, Madam Chair, if I can. So why don't you talk a little bit about the anticipation as we go into winter and what role the city hopefully will be playing in that overflow because we don't have enough shelters.
Yeah, absolutely. Thank you, Arlette. So the city is working on a activation of a winter warming center that would meet the need of some of that unsheltered population. Again, like I just mentioned, the need for shelter far outweighs the availability of shelter. And we know that people need a place to be in the wintertime especially. And so we have been working with a stakeholder group. I have a colleague within the fire department who is an emergency planner, and her and I have been developing what that activation plan looks like. At this time, with our stakeholder group, we've identified the lower level of the engagement center as where we would, house that winter warming center, but it would not be, like a traditional shelter. It would be a place where people would just be able to be out of the elements. And so we have those plans. We're finalizing the budget and kind of some of the trade-offs so that we can have this be as inexpensive as possible. But we've identified that there should be room for about 38 total people to have access to that winter warming center in the lower level of the engagement center.
Thank you. What, you mentioned 62%. Is it the 62% just went up this year, or was it, is it nationwide? Or-
Yeah, so that's a nationwide statistic. And so the 62% unsheltered rate is specifically for the chronically homeless population, which is a very specific kind of subset of the homeless population. So when we look at the overall homeless population, about 40% of people experiencing homelessness are unsheltered. The chronically homeless population experiences that at a higher rate.
Okay. What I want to understand, what is the percentage that we have here in Fargo? That's what I wanted to know. Do you have that by any chance, or?
That's some of the information that we're trying to understand from that
Okay.
point in time count. So we have access to the numbers of downtown Fargo right now because that's where our teams were outreaching. We're still waiting from our continuum of care to have the total count of unsheltered people in our community.
Okay. Is there like going to be a study coming up regarding it, or like a survey that is being done to, that is being done in our communities of the reason why we have so many increase on homelessness and things like that? Just wondering, just curious.
Yeah, the FM Coalition to End Homelessness will be releasing their report as well on the state of homelessness in our community, which I think will highlight a lot of those things. I think what we know about homelessness is that when people in our community experience a high level of economic precarity, we're more likely to see higher rates of homelessness. But we are not experiencing our rate of homelessness at a higher rate than anywhere else in the nation. And so I guess hopefully that kind of answers your question.
Thank you. I got more, but we're running out of time. So next slide. Thank you.
Any questions? As on the topic of harm reduction, I believe it's been since our last meeting. I had the opportunity to take a tour of the deck with Jan and Chandler, so I want to thank them for taking that time. I've heard a lot about it over the last few years, and I just wanted to see for myself what they offered. I was really impressed with the laundry facilities that are available for people, the showers, and then there's even a vending machine in the lobby with different personal care supplies that people can use. And I know you guys are always looking for donations for personal hygiene supplies. So for those interested, please consider giving those donations to the Downtown Engagement Center. And then I had recently seen a newspaper article in the Forum about the Day of Dignity. And so I think Fargo Cass Public Health is partnering with Fargo Parks, and donations for personal hygiene supplies can be dropped off through August 23rd with an event on the 27th at Broadway Square. So just to encourage people to look into that, see what you can donate to support those folks in need. So thank you for what you guys do. Really appreciate it.
Thank you.
Okay, our final agenda item is health officer update.
All right. Thank you, Madam Chair and members of the board. Happy Friday. I was just going to update you, given that it is already back to school time, which is hard to believe, a little immunization update in our state, region, and area. So for once, I have some good news. There's new data from the World Health Organization and UNICEF reporting that about 4 million more children received their routine vaccinations globally around the world, or excuse me, globally in 2022 than in the previous year. So we all know that millions of children around the world miss their routine childhood vaccinations against diseases such as measles and tetanus and the like during the COVID-19 pandemic. But this new data suggests that that decline might be reversing, and it's the first big signs that we've seen of that. And then the number of kids who missed all routine immunizations fell from 18.1 million in 2021 to 14.3 million last year. So pretty promising. However, that number has not returned or I guess ideally we'd want it to drop below the pre-pandemic rates. So for instance, in 2019, we had 12.9 million kids who missed all their vaccines, but trending in the correct way. Unfortunately, I'm not sure that that is the case in North Dakota. This is not an apples to apples comparison exactly, but I took a quick screen grab of our statewide kindergarten vaccine rates. This is often a marker followed by the CDC, specifically MMR rates. So you can just really appreciate a general overall decline here that is a downward trend that's continued. Our MMR rate, for example, in the 2019-2020 school year was 94.75. And then this school year, in the 22-23 school year, our rate is 91.83. And we do actually have counties in North Dakota with MMR rates as low as like 50 to 60%, which is a little alarming. And then also just to note out that our vaccine exemption rates remain very high statewide. I reported to you around this time last year that we crossed the 5% mark, and we stay above that, with the personal belief exemptions just far outstripping the others ones that we see. However, we have recently seen the religious exemptions steadily increase. We are doing a little bit better in Cass County, especially with our school age trends. You can kind of see those just remain stable or even increasing. Overall, our kindergarten age vaccine rates are somewhere between 94 to 96%, which is really great news for us here in Cass County. As a reminder, our goal is 95% for herd immunity to prevent outbreaks. So Cass County MMR rate, just for continued comparison, in the last school year was 92.7%, and this school year we're almost 95%, 94.5%. So trending in the right way. And then our exemption rates just remain lower in Cass County than they do statewide. We tend to average around 3%, 3.25% for all exemption rates. However, a thing that's had a lot of our attention here recently is our rates are even lower in North Dakota statewide for our younger children. So I was just showing you school age, specifically kindergarten. This is data for our kids that are ages 19 to 35 months. And you can just see that we remain very low. 65%, in fact, statewide have received all of their recommended vaccines for this age group. And then just for continued comparison, MMR in this age is only 81%. So really at risk for outbreak if we were to see measles cases. In Cass County, our overall coverage rate for that same age group, the 19 to 35, is also low, about 68%. This is showing for kids in this age group to have had all the recommended doses of the primary childhood vaccine series. And then Cass County MMR rate for this age group is 84%, a little better, but still not where we need to be. And then I'll just end by updating you that the FDA has approved, and actually now the ACIP has recommended this new, it's being called an RSV vaccine. It's not exactly a vaccine, it's a monoclonal antibody, but works similarly to a vaccine. It's used for the prevention of RSV in our really young children. So Nirsevimab is the name of it, and The ACIP voted unanimously 10-0 to recommend the routine use of this for children, for infants up to age 8 months in there, if they're either entering their first RSV season or if they're being born during that season. And actually, it's continued to be recommended for children up to age 19 months who remain at severe risk for RSV in their second season. And trial data for these showed a statistically significant reduction in the incidence of medically attended RSV-associated lower respiratory tract infections. That's 70%, which is good, and lower hospitalization rates as compared to the placebo arm. And just a reminder that every year in the United States, we hospitalize around 1% to 3% of children under the age of 12 months are hospitalized due to RSV. So we're hoping this can help combat that. And this product is actually already available in places like Canada and Europe and the UK. And so it's been around and safety has been monitored for a long time. And it's expected to be available to us in the United States this coming fall, so this RSV season. And then also on the RSV front, the CDC's ACIP has recommended that older individuals now consider getting a vaccination for RSV. So there's 2 products that the FDA approved and have now been recommended by ACIP for this age group of 60 years and older. This was what's called a shared clinical decision-making recommendation. So people are encouraged to speak to their physicians about their personal risk. But the data was pretty good. I took a little screenshot here from some of the trials. The data showed a significant improvement for this age group after taking the RSV vaccines. And one thing that was interesting is that remained effective into the second RSV season as well for these older individuals. And I think that's all I have. Any questions, comments?
I guess with the infant RSV antibody, what have been the results from other studies as far as a decrease in hospitalizations?
I believe it's pretty similar to Synagis from what we, the rates we have from Synagis, but the difference would be, they're very similar products. Let's see if I can pull that back up. The difference would be this is recommended to all infants without any, Synagis right now is a monoclonal antibody we use, but there's very strict checklists. Grant, probably a lot of your patient population actually would qualify for this, but this would be for anyone under the age of 8 months, even without risk factors. So I don't know that it's going to be hard to compare those rates because I think those kids are probably a little sicker at baseline, the ones we currently vaccinate. So this, I think, will be very interesting to see.
Have we seen what happened in other countries though? Like in Canada, did they see a significant reduction since this has been out there longer? Or?
Sorry, that was the older, or no, was that? I think that was the older. Oh no, you're right. No, I don't know that, but I could look.
Thanks.
Yeah.
I should know that too.
We don't think about it because it isn't here, I guess, right?
Any questions for Dr. Newman?
One question. So, Cass County being so low on a number of those immunizations, is that an access issue? Why are we so low?
Yeah, I feel like I ask myself that all the time, and we're actually doing way better than many parts of this state. It's unclear, and the reason I started this presentation with the rebounding numbers we're seeing globally is that I'm hoping that trend will come here. We all know there's a little bit of pandemic fatigue. There's a little bit of just people catching up on their wellness visits. I'm hoping this back to school push can really encourage some of that.
Okay.
But yeah.
Wait and see what happens.
Yeah, one can hope because we certainly have availability and access at Fargo Cass and at our healthcare systems.
Can you drill down past the county level to look at city community levels?
Yeah, actually, so the little all of these that I'm showing you here, it's run by the Health and Human Services website. You can actually go by vaccine if you look at like the top tabs, but also like, for example, the school age rates, you can go to school, like actually by not even county, but where your child goes to school.
Right.
And it'll show you those rates.
Okay, thank you.
Yeah.
I will add too that we are having a walk-in immunization event at our main Fargo Cast building on August 23rd and 24th. That would be 8 to 4 each day. So if there are folks out there that need back to school and immunization for their kids, that would be a great time if, or, you know, either us or physician's office or wherever you want to go, but we certainly want those kids vaccinated before they go back to school.
Great reminder. Thank you, Des.
Yes, agreed. Okay, thank you, Dr. Nguyen.
Yeah, thank you so much.
Do we have any, there's no one in the room for public comment. Do we have anyone online? I don't remember if we're doing that anymore. No one online for public comment?
Can I add one more thing before
Oh,
we?
yes, absolutely, I'm sorry.
I just wanted to say that Dr. Newman has been asked by Dr. Weeby, who's our state health officer, to be part of the state health council. So they, in legislation, they voted this year to kind of revamp that state health council, and part of that was to incorporate local public health. And so they have one local public health health officer from across the state, and Dr. Newman has been chosen for that and has accepted. So that is a really cool thing for us to have just in that liaison role between state and local for us.
Cool. Absolutely, that's good news.
Wonderful.
Okay, we will let the record show that there are no public comments for this meeting. And any other remaining items to be added at the end?
Madam Chair, the only thing I would say is, based on the turnout here, August might not be the best time for a meeting. We might want to consider that next year. Go with September or something.
Agreed.
Yeah, this is kind of our first year of, you know, going to the little bit longer format and then going strictly quarterly, so we can sure look at trying to do some adjusting, although I think all of our summer months are kind of a challenge with it being so short. But the second thing I would mention is also, just as a reminder, if there are agenda items that you would like to see, if you can get any ideas of those to Lynn or to Kayla. We usually meet, you know, a month or so prior to the meeting and talk through any needed agenda items. So please don't be shy about what you'd like to have on these meetings.
Sounds good, thank you. Our next meeting will be November 17th, 2023, and there being no further business for discussion, we will adjourn August meeting.